Welcome back. Joining us in studio right now, we have Stephanie King, and you are the Pregnancy Navigator over at Our Lady of Lourdes Women's and Children's. Thank you so much for being here with us today.
Thank you for having me.
Absolutely. So we're talking about this awesome program for expecting moms. What is the Pregnancy Navigator program?
So this is only in Acadiana, so it's not at any other facility, so I think it really sets us apart. And it's been great transitioning into the role from a labor and delivery nurse to now the Pregnancy Navigator.
Yeah, so as a Pregnancy Navigator, what do you do for expecting moms?
So a lot of moms, they'll contact me about 5-6 weeks, then they find out they're pregnant, and they either don't have a provider. I'll get them set up with one of our OBGYNs, or we also have a great midwife program available at the hospital. So I'll get them set up with a provider first, and then we'll kind of go from there. So if it's a tour for the facility, we'll do a tour. We have great preparing for childbirth class, natural childbirth. I do recommend that all moms take these classes. They're taught by some of the best nurses that we have, and they really get a lot out of the classes. So it kind of just prepares them. So I help them with that, pre-registration, and then I do also a lot of high-risk pregnancies. So they might be needing other care. So I'm in with our NICU, surgery, just making sure everybody knows kind of what's going on with the cases. Some of these cases may be poor prognosis cases. So just case by case, helping with those situations. It
sounds like you're kind of there every step of the way.
Yes.
Let's stay on the topic of those high-risk moms out there. When should they contact you? Immediately when they find out they're high risk?
What happens is whenever you go for your 28-week anatomy scan, our maternal fetal medicine doctors, if they see anything concerning where they feel like I need to be contacted, they will send over those records, and at that point I'll contact the family, and depending on what the prognosis is, kind of depends on where we go further.
Yeah, how have you seen these high-risk moms benefit from this program?
I think just having a contact person, whether it's me that they need to speak to, or if it's, a NICU question, I can get with our NICU navigator and just get them where they need to go. That way their questions can be best answered.
I think this is such a cool program that's only in Acadiana. It kind of really helps those moms out there navigate, because this could be a scary time for some, and there's so many questions. And I know we are almost out of time, but she's going to be here for a whole other segment. But before we go for this time, how can people contact you and take advantage of this program?
They can call the 337-470-BABY, and that will come directly to me. So if they have any questions they need to get me, I can answer any of those questions for them.
Okay, and we have more questions that are about to be answered coming up in just a few minutes, but let's go ahead and check in. All right, guys, welcome back. We're still hanging out with Stephanie King. She's the Pregnancy Navigator over at Our Lady of Lourdes Women's and Children's Hospital, and we're talking about the Pregnancy Navigation program. It's a really cool program that's offered here in Acadiana, and we were talking earlier about some of the high-risk moms out there, but I want to focus right now on those classes that you guys offer. What are some of the classes that moms can attend?
So, and the classes are free, so there's no cost to them. But you can go to the Our Lady of Lourdes Women's and Children's website. Under the Patients and Guests tab, there is going to be a childbirth section. They are able to sign up for, we have a preparing for childbirth class, natural childbirth class, and then we also offer a breastfeeding class.
Wow.
So they're really able to, and I suggest taking all three. They teach different things in all of them. And with labor, things are unpredictable. So you might think you're going to get an epidural, but if things change and you've taken the natural childbirth class, you at least have resources to kind of help you out.
And you're a little more prepared for it, too.
Yes, absolutely.
Now, are the classes like on a day, or is it a series that they need to attend?
So we do it once a month. The preparing for childbirth class is going to be on the first Tuesday of every month, and then the natural childbirth class is on the second Tuesday of every month.
Okay, nice. I think that's amazing that these classes are offered, and they're free.
Yes.
Is there is it like a first come, first serve? Is there a certain number of seats that you guys can accommodate?
I don't believe that we've ever had it to where we've had a class that we weren't able to accommodate. I want to say probably anywhere from 5 to 10 couples come per class. So.
And this program, I'm learning so much. I didn't realize we had something like this here in Acadiana, and it's kind of perfect too, because October, it's kind of an important month to bring awareness about. Tell us about this.
Yes, so October will be here before we know it. October is Pregnancy Infant Loss Awareness Month. So if anybody has suffered a miscarriage, a stillborn, has lost a baby at any point, just to know that they can reach out to me at that 470
Yeah.
baby number. If they need any resources, I can get those, just so they know that they're not walking that journey alone.
I know that can be a very challenging time to navigate too as a family, and knowing that they have someone that they can call to help them, it's probably really reassuring for those moms out there.
Yes, so like I said, they can reach out to me, anything that they need, I can help them with. If they need a different contact person, I can get them in contact with whoever they need. But just knowing that, we have resources available for our families.
And what would you say your favorite part about this job is?
My favorite part is definitely just the relationships that I get to form. Being at the bedside, I only got 12 hours with patients. This way I'm there, before delivery. If I'm there for delivery, that's even an added bonus. But I get to follow the families and just have really close relationships with them.
Yeah. Well, thank you so much for stopping by to sharing this with our viewers. What's that phone number one more time?
337-470-BABY.
All right, go ahead and give Stephanie a call if you're an expectant mom out there. Guys, don't go anywhere. We'll be right back.